Hello and welcome to another episode of Discover with Spinetti. Today we're talking about the difference between teeth and implants. And I just want to share something with you guys because last night I had this dream that I was about to fight someone, like professionally fighting someone, like it was a boxing match, but I didn't train and I didn't have gloves. So I don't know what that means, but that was the dream. So in the dream, I actually canceled the fight because I said there's no point for me to actually even try to fight because I didn't train. I didn't know I was gonna fight. It was kind of just brought on to me. They're like, "Oh yeah, right. Come here. You're registered to fight." And I said, "Well, I didn't train and I don't have gloves." So yes, so that was my dream. So anyway, so because this is a podcast, so it's a little bit informal, but let's get back to the topic, which is the difference between implants and teeth. Now, in terms of implants, I did, of course, prepare for this, and I want to show you. I want to show you what it looks like. So here you'll see on the screen, you'll see the image here, and this is of course from Google. I mean, where else would it be from? This is from Google, dental implants versus real teeth, and here you can see there's a difference between them. Okay, there's a lot of differences. Okay, if you look closely here, and if you can't see this image, I highly suggest you go on Google and you type this thing here, dental implant versus real teeth. Okay, and you'll see these kind of things here. I'm going to go through them just so you can understand that there is a big difference between them. The overall result, which is the above the gum, is very similar. Okay, this is here what we call the crown. Okay, the crown portion, or the head portion, the crown portion of this entire structure is the same, but everything else is different. So let me go through it. So in terms of a tooth has several things in and outside the tooth, but the implant only has a few components. So there's that structure by itself should really kind of like really shock you into thinking, okay, well, look, they're different. So let's pay attention. So here you see here on the tooth, there's enamel. So the enamel is the outer portion of the tooth. There's dentin. The dentin is the second layer of the tooth. The pulp houses all the nerves and the vessels. So you can see right here, this is three layers of one structure of a tooth. Whereas here you have basically the implant. Okay, this is the screw portion, the implant, the the abutment, which has the screw in it. So the abutment contains the screw, okay, together. And then you have the crown. Okay, so you have three components, but includes the roots. I didn't even go through the roots here, right? So in terms of the top portion is you have the crown portion, which is usually porcelain, some form of porcelain, and then you have the abutment. So you have these two layers. Now, in terms of the below the gums is a lot different. So here you have blood vessels, like I said, and you have these things called periodontal ligaments and you have nerves. Whereas here, there are no periodontal ligaments and no nerves. And that's significant because periodontal ligament plays a really big portion in your fighting infections, in absorbing the shock or the stresses of your chewing, of your grinding. And it allows the periodontal ligament to actually attach very, very strongly onto the tooth. So, in order for you to lose a tooth, a lot has to happen in order for you to lose a tooth. Not so much needs to happen in order for you to lose the implant. So the implant, there are two different types of diseases with regards to these two structures. One is called periodontitis, which involves you losing bone structure and losing the attachment tissue, which is the PDL, the periodontal ligament. Whereas in order for you to lose the implant doesn't just all of a sudden, starts to loosen up, and then, then all of a sudden, like you start feeling it more and more loose. No, it's either it's inside your bone, fused to it, or it's outside your bone. There's no in between. Once it starts getting quote unquote loose, it's out, right? It doesn't actually stay in. Whereas the actual tooth, because of the PDL, you can have major infection. The tooth could be a little bit loose, but still be incredibly difficult to remove. So there's a huge difference between the normal tooth and the implant tooth. Furthermore, I'm going to talk about a little bit of the fusion. So in terms of the fusion, or what we call the osseointegration, so this is where the bone actually becomes fused as part of the titanium. Now, if you were to compare it to, for instance, hip replacement, the exact same thing happens. So the hip replacement, the titanium, gets fused as part of the bone, and same exact process happens here. Now, obviously, the procedure is different, but the mechanism, the biomechanical kind of mechanism is the same. So that's the biggest difference between having a tooth and having an implant. The other big difference between them is the fact that in a normal tooth, the one that doesn't have any obviously cavities or large fillings or whatever, that majority of the tooth is protected by enamel. Enamel is a very strong force that protects you from getting infections, protects you from getting cavities and whatnot. Whereas the implant doesn't have that. The implant is porcelain. So yes, you can get cavities through the porcelain, but it's nowhere near as resilient as the enamel. So these are the biggest differences between the tooth and the implant. Hope you benefited, and if you have any questions, of course you can always feed them to me because I'm more than happy to help you out with your questions and your journey towards beautiful oral health. And until next time, and as always, keep smiling.